To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we're going to talk about spinal decompression, and we're going to tell you all about that because I am joined by Dr. Brandon Dyrdahl from Integrity Health and Wellness. Hey doctor.
Hi.
So I wanted to have you on because a lot of us suffer from aches and pains that probably could be helped with a little chiropractic. At your practice, what are you seeing most people come in for?
Generally, it's going to be more of that neck pain, low back pain, and some extremity stuff, shoulders, knees, things of that nature, caused by a wide variety of different things. Car accidents, slips, falls, and just chronic stuff as well.
If somebody's waking up every morning with that sore neck, what's your process to figure out what's going on?
Well, we like to do an in-depth evaluation, and sometimes we'll take x-rays if they've never had an x-ray before and they have unexplained neck pain, just to kind of dive a little bit deeper into what's going on. And then we'll do some chiropractic adjustments a big chunk of the time.
And in that process, how long does it take somebody to say, oh, my neck is feeling better?
Usually, I like to go by the 4 to 6 week rule. If we're making really good progress in that time, we're on track.
Good. Well, I did now wanted to jump into spinal decompression. You did talk about backs earlier. If I'm somebody, what would my symptoms be to be a good candidate for it?
Yeah, absolutely. It can be anything as minimal as just stiffness every morning when you wake up, or if you sit for a long period of time and you have a hard time standing up and straightening out, all the way to really severe pain, a sciatica, shooting pain down your leg, kind of everything in between.
Yeah, and you're a good candidate. So it sounds cool, spinal decompression. What is the process? What do you do for people?
Yeah, so typically we'll have the exam, we'll figure out what's going to be the appropriate course of action for them. But you're going to lay on your back on a table and you get this belt wrapped around your hips, and it helps give you a nice gentle stretch in your low back, because usually the issue is going to be disc related. So if the disc is compressed, we really want to open that up and provide relief to the nerves.
Yeah, and just open that right up and make you feel better. And in that one again, if we're going through that treatment, when should I know I'm feeling better?
Well, usually we like to start off with a small care plan of about 12 visits or so over about a 4-week period of time. And we should know around that time if it's effective and if it's giving you relief.
And you said earlier, no more coping or living in pain, right? You can feel a lot better.
Exactly,
Yeah.
and our big thing is naturally, we want to get you pain-free.
Well, doctor, thanks so much for being here and keeping our necks and back in line. And we want to thank you for watching To Your Health.
The preceding was a paid advertisement.